So I think 2017 ASH is going to be a very interesting congress. Probably the main large trial result that I'm looking forward to is Echelon 1, which is in Hodgkin lymphoma, comparing ABVD with AVD plus Brentuximab vedotin. That's in the previously untreated advanced stage classical Hodgkin lymphoma. The headline result is tantalizing, in that there is a statistically significant progression-free, or I should say modified progression-free survival advantage, because they use this slightly unusual primary endpoint of modified progression-free survival. It was only around 5% the benefit at 2 years, so that I think there's going to be a lot of discussion about possible subgroups that may or may not show enhanced activity with that combination. And it'll be a very interesting discussion. It will be an expensive combination, so whether a 5% 2-year modified PFS advantage will be deemed cost effective, particularly when there is a toxicity signal of neuropathy and neutropenia and infection with AVD plus Brentuximab, I think is going to be up for debate. But it'll be very interesting to see that data presented in detail. And also, there is some very interesting data being presented of new agents. ASH is full of new agents now. It's a very exciting time to be in the lymphoma field. And I've said before, but it's really the antibody-drug conjugates I'm interested in. There's one fascinating antibody-drug conjugate called ADCT-301, which targets CD25. Now, CD25 is expressed on a lot of hematopoietic malignancies, such as B-cell lymphomas, Hodgkin lymphoma, T-cell lymphoma, but it's also on regulatory T cells. So you would expect it to deplete your numbers of regulatory T cells, which may have beneficial consequences. So it may then allow the immune system to attack the lymphoma, a bit like other immuno-oncology agents. But of course, it may lead to toxicity. If you don't have T regulatory cells, you may develop autoimmune toxicities. And the data that's already in abstract form suggests both of those things. Yes, high activity, particularly in Hodgkin lymphoma that's relapsed after Brentuximab and a PD-1 inhibitor, but also a significant signal of toxicity in the form of polyradiculopathy and Guillain-Barre syndrome. So it's going to be fascinating, I think, to see these new molecules presented.